Good afternoon. My name is David Blackburn. I'm your Bell County Judge. This is a COVID-19 press briefing, and I'd like to introduce Dr. Chadwell with the Bell County Public Health District first for comments.
Good afternoon. I'm going to try and cover some of the questions that we've received up to today, not just the ones that were sent for the press conference, but a few common questions we've been getting. And I'm sure you've all noticed that the dashboard has seen some rises in cases recently, and there are a number of factors. I mentioned some of those yesterday, but I'll reiterate. Reopening, we've seen more people gathering. One of the most concerning trends for me is it seems like people are kind of forgetting about COVID. They're going back to that life is normal. And early on, I had said that when we start to shift back to reopen, don't hit the gas really hard. Don't go from 0 to 60 quickly. And that kind of seems to be what people are doing. And that is driving, in part, this increase. Doesn't mean we have to shut our doors everywhere, but I do ask the people, please be more careful, mask, socially distance, hand hygiene, take that extra precaution, particularly if you are high risk. And I'm going to add a couple of points because this has been a question too. High risk isn't necessarily just over 60. Now, most people over the age of 60 are going to fit into that group. However, if you have a history of smoking, vaping, if you're obese, those are risk factors too. So please bear that in mind and think about the people that you come into contact with. If you're like me, 35, no health conditions, I still have elderly parents in my home and I have to think about them. So those are all things that I just want to reiterate. Please take care. Try and drive these numbers back down and level things out a little bit by engaging in those behaviors. And we did get some questions about contact tracing. I am deferring to state on that because we're not doing that anymore, but I'll talk a little bit about case investigation processes. The way that works for us is we receive a case, and that's usually in the form of receiving a laboratory report that gives us some contact information for the case. We reach out to them. There's some paperwork involved, a case investigation form from the CDC and state. We utilize that form to collect data from that person, including who their contacts were. That form is used to enter that data into the state Texas Health Trace system. And from there, contact tracers at the state contact their contacts. I hope that's somewhat clear. So I've gone over my thoughts about the increases and avoiding complacency. I want to talk a little bit about the dashboard because you might see some changes up and coming. We're not going to remove anything from the dashboard, but we might add some components to it. It's a little busy right now. So if you notice changes, then you don't see a chart that you saw before, look toward the bottom. You'll notice there might be some tabs for shifting to a new screen to pull those charts back up. So don't think that we deleted anything. We have no plans to do that. Another question we've been getting very frequently is with regard to businesses that have had confirmed cases that have opted to stay open. And I want to be very clear. We make recommendations to businesses. Often our recommendations are about the strictest we can make, which are close, sanitize. We might recommend closing for as much as 2 weeks, depending on the scenario, but we cannot force that. We have zero regulatory authority over these agencies. The only authority we have at the health district is with regard to the Texas food establishment rules. Someone in a restaurant with COVID does not necessarily violate those rules, though there are exceptions to that. And we have regulation authority over septic maintenance and installation. That's about it. So we make recommendations, we educate, we hope people listen. But if a business opts to stay open, that is their decision to do that. And there's not a whole lot we can do about that. So we're just going to keep doing what we can to educate them. Now, herd immunity is another question I've received quite a lot of times is, should we just let people get infected and develop immunity? We don't know that immunity is acquired with this virus at all. And I've been trying to keep very close with the literature. I actually read another article out of, it was JAMA, I do believe that article came out of, in which they stated again, we don't know yet. So having COVID-19 does not necessarily mean that you're protected from getting it again. And it's important to remember that. Now, let's see, nursing homes. So other than the one outbreak that we had at the Westin, we have not seen any others with significant caseload so far. I hope that we don't see that again. There was a particular question about Park Place having multiple cases, and we do not have evidence of that at this time. We have one positive associated with that facility that prompted testing, but there are quite a number of them that are pending. I do believe there were 136 pending. So that information may change, but if there's something to report out of that, then we certainly will do that. There was a question about company Monteith Title. I'm not aware of any cases out of that facility, but please remember, it might take us a couple, 3 days to figure out where people work, because again, all we're getting is a lab report. The doctor also calls the patient and lets them know if they're COVID positive, and usually their first call is going to be to their employer. So the employer may know before we do. So just give us a little time to catch up. And I think those are all of the comments that I have based on questions we've been receiving and information we've been getting. Is there anything for me?
Hey, Dr. Chadwell, it's Jacob from Telegram.
Hi, Jacob.
How do you fight complacency and boredom? Like, how do you get it through people's minds that this virus is an issue? How do you get it? Yeah.
Oh, that is hard, Jacob. That is a struggle that public health experts have been fighting forever. Changing behavior and getting people to do what we ask them to do has always been hard. I mean, we think about this when we talk about eating healthy foods. It's hard to get people to engage in that behavior. What we focus on doing is our due diligence in making sure that we're very upfront, we're very honest with everyone, and that we continue to push the information out. And really the best we can do is hope. And, you know, we educate our policymakers, and they're looking at making decisions related to policy. We do our best to try and enforce public health, good public health in those ways too. But that's really hard to do. We're just going to keep repeating ourselves and just hope it sticks. Anything else?
Yes, this is Hunter King with the Clean Daily Herald. I just have one other place that I wanted to bring up to you. We got a tip that maybe Indian Oaks and Harbor Heights had cases. Have you heard anything about that?
Yes, and I'm trying to remember. I want to say, don't quote me for sure. I can send you an email and double check the number, but I think they had 2. And so it was very limited there, but they might have some pending as well. So I'll have to double check the numbers.
Okay, thank you.
You're welcome.
Dr. Chadwell, I know a lot of bigger cities like Houston are considering going back to a shelter in place. Is that something that Bell County is considering the recent spike?
I do not have the authority to answer that question, so I'll have to defer to people that do have the authority to answer that. So pause on that one for a minute. Anything else? Okay, thank you.
I'm sorry, I couldn't get mute undone. I do have a question for you.
Yes.
I was wondering if you could talk a little bit about the positivity rate, if you've seen any changes in that over time. Obviously, we're seeing more cases, but has that rate stayed close to the same, or is that going up as well?
So I would have to actually look at the calculations for it. I apologize, I did not run those numbers. So I don't want to say, I know, again, a lot of testing, it may not be much of a change, but I'll have to get back to you on that. If you will shoot me an email, I'll run the calculations on that with our data and get back to you.
Thank you.
Okay.
I've got one topic that I'd like to address for you today, and that's the Bell County Jail. And then, well, actually another topic, and I'll address that briefly, and then I'll certainly take any questions that you might have also. As of today, we have 4 inmates in the Bell County Jail that have tested positive for COVID-19. What I'd like to do is run through a little bit of a timeline for you that hopefully will shed some light on what's happened over the past few days relative to leading up to 4 inmates testing positive in the jail. On May 20th, we have what we've designated as patient 0, who arrived at the Bell County Jail, was housed in one of the, what I'm going to call a sub-pod. Sub-pod B as in Bravo, 1A as in Alpha. Patient 0 went through the health screening process that all inmates go through upon entering the facility and demonstrated no symptoms of COVID-19. In other words, he was asymptomatic upon arrival at the jail. On May 29th, 9 days later, patient 0 was moved to the infirmary in a quarantine area and a negative pressure cell. because at that point he advised jail staff that between the time he had been booked into the jail and the time and May 29th, he had had a conversation with a family member, and that family member advised him that someone in the family had tested positive for COVID-19. So as soon as jail staff was aware of that, they moved patient 0 into the infirmary. On May 29th, patient 0 was still asymptomatic. On June 3rd, which was, there's a couple of days in between there, and that was the weekend. But on June 3rd, our healthcare provider at the jail WellPath recommended that patient 0 be sent to the emergency room due to COVID symptoms. Patient 0 was transported to Baylor Scott and White. The ER doctor there confirmed by a clinical diagnosis that patient 0 was COVID positive. However, the patient 0's condition did not warrant admittance to the hospital per the doctor, and patient 0 was brought back to the jail and placed again into quarantine in the infirmary. Patient 0 was also given COVID-19 test at that time, a nasal swab, which was submitted to Scott and White for review. On June 3rd, the same day, B1A pod, where patient 0 had been placed between May 20th and May 29th, was placed on observation quarantine per our COVID-19 guidelines. All inmates in the B1 unit began having temperature checks twice a day and continued monitoring for any symptoms. On June 5th, patient 0 COVID test from Scott and White was returned, and it confirmed as a positive COVID test. On June 7th, patient 1 and patient 2, these are both inmates, demonstrated COVID symptoms, which included low-grade fevers, and were administered the COVID-19 test. That test was sent to the lab. Both patients 1 and 2 were inmates housed in the same pod as patient 0, which is pod B1A. On June 8th, another inmate, patient 3, demonstrated a low-grade fever and was administered a COVID-19 test. That test was also sent to the lab. Patient 3 is also housed in pod, or was housed in pod B1A, which is the same pod as patients 0, 1, and 2. Yesterday, on June 11th, we received confirmation on patients 1, 2, and 3 for positive COVID-19 virus. Patients 1, 2, and 3 have been removed from pod B1A and housed in the infirmary, which are negative pressure cells, which are in quarantine, which is where they remain as of this briefing. In consultation with our on-site jail healthcare provider, who is WellPath, and the health district and the health authority, we are continuing to do health screening on all incoming inmates and staff to the jail. We've also increased our health screening inside the jail and specifically in the B1 unit area. In addition, we have placed the B1 unit on lockdown, and it is under quarantine, meaning that there is no inter-jail movement of the inmates in the B1 unit. Jail staff entering the B1 unit are in full protective gear and have been so since June 3rd. And then I've got just a couple of notes here. The total number of inmates that we have in the jail as of this morning was 706. Total number of inmates in the B unit, B as in Bravo unit, as of this morning was 216. Total inmates in the section B1 of the B unit was 108. And total inmates in the pod B1A, and there were 4 pods in the B1 section, but in the B1A pod, which is where all 4 of these inmates were, that inmate population is 26. Patient 1 has been incarcerated since September 25th, 2019. Patient 2 has been incarcerated since February 26th, 2020. And patient 3 has been incarcerated since March 12th. As I said a moment ago, health screening has been in place for several weeks at the jail, and the staff that goes into the B unit are in full protective gear, as I said just a moment ago. I'll pause there. I've got a couple of other topics that I'm going to address based on some questions that came in, but I'll be happy to take any questions you might have about the jail. I've gotten a couple of questions. Yes?
I'm sorry, I have one question on the jail. Do you know how many inmates total have been tested?
We are testing inmates that are symptomatic. And to my knowledge, the 4 that I have just mentioned are the 4 that have been tested. And again, just to reiterate, every inmate that processes in the jail goes through health screening, which includes temperature check and going over the checklist for COVID-19 symptoms, along with any other health issues that they might have. That's done before they enter the jail. And then we are monitoring and have continued to monitor once inside the jail. And again, we've stepped up those health screening procedures and protocols in the B unit as a result of these COVID cases. But to answer your question, we have 4 tests in the population right now, or we've done 4 tests.
Okay, thank you.
Any other questions relating to the jail? I was also asked in some email about the City of Temple plans to host a 4th of July fireworks show or festivities, and the question was it up to me to decide whether they were allowed to move forward and which way am I leaning? I just received a copy of an email from the Temple City Manager and a copy of their proposal for their 4th of July plans. I've told them that I'll review that over the weekend and I'll get back to them with whatever comments I have. They have sent that plan per the governor's orders, or his last order relating to this, to myself, to the health district director, as well as to the mayor of Temple. And so I think all 3 of us will probably be weighing in with comments, and I'll get those back to the City of Temple. The next, or the last thing that I was going to mention was just in relation to some of the comments that Dr. Chadwell made and questions that I've just been seeing come across my desk relating to cases and Bell County conditions and those kinds of things. I did reach out this morning again, as I have done at least weekly, I guess, and more often than that sometimes, but I did reach out to the CEOs for Advent Healthcare Systems, for Baylor Scott and White, and for Seton Medical Center. And I asked all of them what their current hospitalization rate looked like for COVID patients, as well as their capacity. Because if you all will remember, one of the prime factors, driving factors for both health authority recommendations as well as the governor's recommendations in terms of shelter in place, or in releasing some of those shelter in place orders and reopening Texas, has been associated with maintaining adequate hospital capacity. And here's the short version of the conversations I had this morning, but the short version is all 3 hospitals report more than adequate capacity in the hospitals as of today. The total number of patients, COVID patients, were 16. So there are 16 COVID patients in all 3 of those facilities total, and 5 of that 16 are in ICU, and one of the hospitals reported 0 COVID patients in the hospital. But I did ask the specific question about whether or not they were in compliance with the governor's order to retain 15% of their capacity, their bed capacity. All of them indicated they had that, and additional capacity above that. So I think it's important, while the case numbers certainly continue to climb, the hospital capacity, which is one of the things that the policies are aimed at mitigate or creating and maintaining, is certainly being maintained in Bell County. And it seems like I had one more question, but I can't look at, oh, I know what the question was. The question was whether or not the county would be considering returning to shelter in place orders. And the answer to that is no, because the governor's orders have superseded and preempted any local jurisdiction, in my view, from instituting any orders that are in contravention to any order that comes out of the governor's office. So there is no consideration of that. Be happy to address any questions that I have not already addressed.
Hey, Judge, it's Jacob.
Hey, Jacob.
I was wondering, what can you do since the governor's kind of stripped all local officials of any power to really control the pandemic at a local level? What can you do?
Well, I think what we can do is, as Dr. Chadwell mentioned, I think that the best thing that we can do at the local level is probably two things. One is to continue to inform and educate. And I think the health district has been doing that on a daily basis. We push out information as we can about the recommendations: washing your hands, social distancing, wear your face covering when you can't do social distancing. I mean, all of those kinds of things. You have to continue to push that information out, and hopefully it gets pushed out in such a manner that it doesn't become tedious or drone-like in the sense that it loses its effectiveness. And I think that's part of the concern that many have, is that while, and our case numbers show that the cases are continuing to increase, it has not subsided in terms of cases. And I think part of that is, again, just a challenge in terms of getting the information out, and then also people just receiving that, because I think, again, it's become somewhat tedious in that. But I think that's one thing we have to continue to do. As tedious as that is, we need to continue to inform and educate in terms of what's happening in the numbers. I think the other thing that we need to do is continue to monitor what, again, the governor has indicated are key factors in terms of reopening and moving forward through this pandemic. And that is watching our hospital capacity and making sure we don't have surges that exceed that hospital capacity, which the data does not show that occurring at all. And that positivity rate that one of you asked about just a moment ago, and watching that to see that that remains somewhat constant, even if the number of tests go up and even if the number of positive cases go up, that positivity rate remains somewhat constant. And again, both of those, at least the last time I looked at the positivity rate, was fairly constant, even though I think we've done over 20,000 tests in Bell County now. But that's the two things that I would urge: is we've got to continue to educate and inform. We have to also continue to watch our hospital numbers and make sure that the capacity is there. And then we have to make sure that we have an open dialogue with the governor's office in Austin, which we do, to make sure they're aware of what's happening here. Any other questions?
Hi, Judge. This is Megan with Channel 10. Just following up just on that last point that you made, I had asked you a few weeks ago, what your communication channels were like with the governor's office. So it sounds like those channels are still open and you're still in conversation with them. I guess I'm wondering if you're considering asking them if we can shut down Bell County, or what would trigger that, if you're thinking through that process of how you would approach the governor, if you think that would become necessary here.
Yes. Again, the governor's line has always been open. And I'm at this time, again, what we're doing is communicating numbers and information and data to Austin. And then the dialogue continues in terms of what is done with that. Any other questions?
Real quick, do those 4 jail inmates, those are counted in the county's case count, is that correct?
I believe so. Yes, that is correct.
Okay, just checking, thank you.
Any other questions? Thank you very much.